Impotence is another word for erectile dysfunction. They're one and the same thing. Erectile dysfunction, or ED, is a condition that's described when you can't achieve or maintain an erection for long enough for sex to take place. It's a really common condition. About 1 in 4 men will experience it at some point in their lives. There are lots of different causes, and it's really important that we try to find out what the underlying cause of your erectile dysfunction is before we recommend any treatment for you. So there are lots of different causes for erectile dysfunction, and I'll list a few for you. We can break them down into a few categories. You've got physical causes. These can include things like diabetes, high blood pressure, or heart disease that affect the arteries or the blood vessels in your penis. There are anatomical causes, so if you have any scarring tissue or scar tissue around your penis, it might mean that you can't get a proper erection. There might be hormonal imbalances that cause problems for men as well. One of the big causes for ED comes from psychological causes. Men who are stressed or anxious or depressed, especially if you're starting a new relationship, might find that it's difficult to get an erection. Then there are lifestyle issues. If you smoke, are overweight, or if you're taking recreational drugs, this can also lead to ED. Sometimes there are medications that doctors might prescribe you as well that might have a side effect that causes ED. It's important to talk to your doctor if you think that might be the case. Some men also think that when you take medication for ED, you're going to be walking around with an erection permanently for a day or two, but this isn't the case either. In order to get an erection, you're going to have to be stimulated or aroused, and once you've had your orgasm, the erection will go. It's just that when you get your erection, it will be stronger and last longer than you're used to. So you can get erectile dysfunction treatment through a variety of ways in the UK. It's either prescribed or non-prescribed. The non-prescribed version is Viagra Connect. That's the only type of medication you can get without a prescription. You can go to a pharmacy and speak to a pharmacist face-to-face and get that over the counter. But a lot of men don't like doing that. They prefer to do this online because they don't need to talk to someone about an intimate issue like ED. So what you might find is easier to do is go online, fill out a quick and easy questionnaire that we can provide at ZAVA. The doctors will then assess your condition and tell you what's the best treatment for you to be taking based on your lifestyle, medical condition, and your needs. Potentially, it really depends what the cause of your ED is. Sometimes if it's caused by a psychological issue like anxiety or stress, maybe because you've started a new relationship, then with the right support and help, you might be able to get over that and your ED will be cured. Some men might need a little bit more support, so they might go and see a psychotherapist. But if it's caused by a physical problem like diabetes or heart disease, which is more common in older men, it's unlikely that you're going to find a cure for your ED, but we might be able to help you more by treating your condition better. If you have ED that's caused by medication or drug that you've been prescribed, if you go and talk to your doctor, they might be able to switch you onto something else that won't be causing the same problems. But the best thing to do is to either speak to a doctor or go through an assessment like the one that we provide so that a doctor can give you more information and tell you what is the best route for you.